Hello everyone, it's Dr. Mike. We're back here for tip number 45 in our MET 101 ebook series. Now, tip number 45, can I offer MET services in clients' homes? Now, folks, you guys already know the answer to that, but let me answer it. Yes, home-based medical exercise training services are one of the most frequently used options by medical exercise professionals. Even owners of MET facilities offer home-based services for their clients. As I mentioned earlier, physicians sometimes request MET home services for clients that are homebound. Folks, think about it. Mrs. Smith had a total hip replacement. She comes home from the hospital, or maybe she goes to a nursing home. She gets physical therapy in a nursing home. Then she comes home, she has a therapist that's coming and helping her, but Medicare says you can only get 8 visits. Mrs. Smith is an adamant member of the church, and she wants to be able to get out of the house and go to the church. She wants to be able to go to dinner with her girlfriends periodically, and she's going in to see her doctor for follow-up visits, and she's just asking the doctor, Doc, I can't get out of the house. What do I do? This is when the physician says, hey, if you're a medical exercise specialist, you maybe go in and knock on the door and you introduce yourself to the doc, and can you go to clients' homes? Folks, keeping individuals independent and keeping them mobile so they can get out of their homes is one of the major issues that we see in our healthcare system right now, because we do have so many seniors that are in the healthcare system. Medical exercise training done in the home, I have to be honest with you folks, I think that's the most important aspect of medical exercise training, going into clients' homes. So if you own a studio, make sure you have staff members that are willing to go in and work in clients' homes. And you should do it also because that is the bedrock of medical exercise training. And as our healthcare system changes, folks, the need for individuals to go in and work with home-based clients is going to become bigger for physical therapists, occupational therapists, nurses, and we're going to need to transition those clients from licensed therapy services to medical exercise services. So make sure that you got your driver's license ready and you're ready to get mobile equipment to take it into these clients' homes because they need it. Now, even if you open an MET facility, make home-based services available for appropriate clients. Also, you should charge for home services at a higher rate to cover the cost of gasoline and mileage. And certainly now, we look at we go to the pump and we fill up our gas tanks now, it does make a difference. So with that, folks, please make sure you include medical exercise training services done in a home setting as part of your menu of services. The need for that will grow exponentially over the next 20 years. All the best. We'll see you in tip number 46. Take care.